Hello, good afternoon. And my name is Dr. Trudy Ufundu of Snowspirations Global Health Solutions. On this evening's YouTube live stream is the last video for the month, and it's actually the most important video of all my series. Today, we're going to look at the cost of IVF in Nigeria. IVF stands for in vitro fertilization. With the advent of IVF about 4 decades ago, so many couples who could not even dream of becoming parents successfully became parents. Not for one kid, not for two, not for three, not for four. Some succeeded in having quadruplets, triplets, twins, against all odds. Now, this is what we know. With the advent of modern technologies in what we call assisted reproductive technique, IVF over time became commoner and more reliable as the final bus stop for getting results. Now, the cost of IVF, it's very contentious. Globally, it's expensive. Now, when you compare the cost of IVF in America, in Canada, in UK, in Australia to Nigeria, it's like a drop in the ocean. An average cost of going for IVF in America is about $10,000. That's baseline. Like baseline, there are a couple of other ancillary fees you're going to pay. And unfortunately, most insurances might not cover the IVF cost. But this is what we know. The same technology we have in America, in UK, in Canada, in Australia, we also have them in Nigeria. And for our organization, Snowspirations, we have few certified, verified Ivf providers in Nigeria. So today we're going to talk about the cost. We're going to look at the factors that might influence the cost of having IVF in Nigeria. And we're going to hunker down. And I'm going to give you estimates of what I could find. Now, what I'm going to give you, it's estimates. It's not final. Everybody's case is unique, but this is what we know. IVF works. Regardless of where you live, if you're a Nigerian or if you're not a Nigerian, but you have access to Nigeria. I recently had an experience. One of my clients I sent to Nigeria, she lives in Atlanta. On her way back from Nigeria, she met a Black American. And they chatted up, and she told the Black American that she actually came from Atlanta to Nigeria, and she succeeded in becoming pregnant. So they struck up a conversation and they exchanged numbers. And this Black American lady actually took it upon herself to go to Nigeria to try. Guess what? She succeeded in becoming a twin mother today. This event happened in 2019. She became a mother 2020. So sometimes where you think you might not find something good might actually be where you will find something good. So IVF works, and it works in Nigeria. So we're going to quickly start. Now, IVF is generally dependent on some key factors. Number one, the package you are choosing. So there are different packages. Now, number two, the uniqueness of the patient's situation. So no two individuals can be the same. The cost of your infertility might be entirely different from the cost of infertility in a different person. So the exact cost cannot be predicted. Until the prospective couples have actually been consulted by the IVF center, it will be difficult to tell you exactly the cost. But this is what we know. Most IVF centers that cater for people actually look at people from different economic backgrounds. So they devise their packages for different people. So they have basic package, standard package, VIP packages. Now, some people are also blessed for the essence of having people that can come in. So there are some organizations that go in there to give subsidized IVF. IVF helps couples that are struggling with infertility to become pregnant. And it's the most successful technology all over the world. From researches we've analyzed in Nigeria, per cycle, they have about 40 to 43% success rate of women below age 37. So the kind of cutoff point is age 37. There are so many things that happen in the body of a woman at age 35 But when you get to 37, there are drastic changes. So from the data we have, 40 to 43% of women under age 37 will have good outcome. 13 to 18% of women above age 40 will have a good outcome. So if you look at it critically, you will discover that the younger you are, the better the outcome. But anybody can go out there and go for IVF and succeed. So someone recently kind of had a humor about going for IVF in Nigeria. The person actually made an analogy between buying a Tokumbo car. So the person was like, the cost of getting IVF done in Nigeria is equivalent to buying a good Tokumbo car. And somehow, when we did our cost effectiveness and analysis, it came out to be about true because generally, IVF is not cheap. So like many fertility centers, it can be expensive, but generally, it's affordable, depending on the perspective you're looking at it. IVF is a multi-step process. So for each step, we need the egg, we need the sperm, then we need the womb. The process will involve so many rounds of checks on the eggs, on the sperm, on so many tests. One round of IVF can actually take a lot of time. And if it fails, you can go for another one. So when I mean round, it's actually in cycle. So most women might need to go for 2 cycles before they can succeed. Now, before you can assume that you can afford IVF, please book appointment. Most fertility centers will give you free inquiry and appointment. Get a quote from them. Now, when you get a quote from a particular clinic, get a quote from another clinic. Let's say Clinic A gave you a quote of X naira. Then you go online and you find Clinic Y and they give you another quote of X, Y naira. Now, before you make up your mind, it's important you do so many investigations. Your price alone should not be the criteria for knowing if you're going to go with a particular clinic or not. There are so many things you have to take into consideration, both quality and cost. I want you to think about the cost, but I also want you to look at the quality. Before you jump to any clinic, because their prices are lower, please make sure you're getting the full quote. Some clinics will just give you some quotes in parentheses. Then by the time you go there, you begin to see other hidden estimates. If one clinic is giving you an estimated value for everything, whereas another clinic is giving you just some of the cost, please, you are better served going with a clinic that gave you everything in a package. So when you get your quote, ask the clinic in plain language if there are other prices you're going to pay in the future. If there are pre-IVF fertility testing and consultation, ask them in black and white. Be aware that the clinic may require to repeat the test you've done before. The reason why we want a newer test, especially within 6 months, is to know your baseline. So if you choose a clinic far away from you, remember to factor in the travel cost. Some people might end up being in a hotel. Some people might end up using their vacation from work. These are all important. It helps to track all your expenses from your pocket over the period you're considering going for IVF. It also helps to save ahead of time. You may pay for your medications. You might also go for genetic counseling, diagnostic test, follow-up appointments with the doctor. These are all costs that will come up. You may also pay for previously frozen eggs, or you're looking for securing donor sperm or donor eggs. These are all contingencies, expenses you're gonna pay. Now, before you panic, remember there are so many discounts out there, and so many IVF providers will give you so many payment programs. So before you chicken out, before you say, oh, IVF is not for you, ask them about different payment methods. Some of them will also have program for refund. So when your IVF fails, some of them might give you 50% discount, or the next cycle, they will knock up 50% for you. So if you are considering IVF, figuring out how you pay is the most important factor, but it's not everything. It's no secret that in our environment, family will play a lot of roles. So if you are going for IVF, you need a lot of family support. So your friends, your in-laws, your office people, your boss, your colleagues, they can all come together to support you. They might not give, but they can give you a lot of social capital. So you should also save up. Take private loans. Some people might not even know that their organization can sponsor them to an extent. So ask questions. It's important you do this. So the long and short of everything I'm talking about is the fact that IVF is not cheap. However, your actual cost may be less than you think. Some people might also have access to health insurance. So please take time and research, plan. For many people, time could only be short when they are considering IVF. Like if you're coming from America or different other places, you might have only limited time. So it's important you save ahead on time. Many fertility clinics, like I mentioned, will offer you payment program that will help you to pay in a painstakingly less painful way. So don't just write IVF off until you've talked to the clinic about your options. While price, it's very important. Quality, it's what you should be considering. So quality is what? Everything. Now, what are those things that will likely lead to different costs in your IVF? The number of cycles you're going for. The medication. So most of the packages they will give you might not factor in the medications. The medications in Nigeria, you might need about 500,000 standalone. Now, if you're going for 2 cycles, 3 cycles, 4 cycles, the cumulative price might be cheaper compared to going for one cycle. The average cost for just 1 cycle is about 950,000 to up to 1 million. Now, the initial consultation fee with the IVF specialist should be about 100,000. Now, some people might need to screen for the egg and do baseline investigation. That one will be giving you around 160,000. Now, if you are also using a donor egg, that's an additional cost of about 100,000. Now, some people might also need to go back for complete reassessment. And some women might need to go up for follow-up specialist appointment. These are all things that will lead to more cost. Now, some people might also have a need for surrogate. So in surrogacy, for some reason, your womb will not be able to carry your baby. So you might need another lady to carry your baby. In that case, it's a little bit more expensive. Now, the drugs for you and your surrogate will also add a lot of cost in the total package of IVF. So the most important thing to do is to know that it is possible, but you need to know the factors that will lead to increase in the cost. Some women will go for embryo freezing. Some women will need donor egg, donor sperm. Then the number of cycles you go for will depend on the cost. So if you're going for just one singular cycle, it's about 950,000 to 1 million. If you're going for 2 cycles, it's about 1.3 million. If you're going for 3 cycles, it's about 1.8 million. So the number of cycles will determine the number of money you're going to pay. Now, if we are involving donor egg or surrogate mother, it will further add cost to it. Now, the constant factor in IVF is age. So how you will react by the time we start giving you IVF treatment is actually based on your age. The younger you are, the better the option. So for couples below 35, the success rate is about 40 to 45%. But for couples from 35 to 39, the success rate is about 30 to 35. Now, if you go a little bit further, so if you are above 40, the success rate begins to dwindle, about 10% or even less. So you are better served when you know the factor that age, when you know the role that age can play. Age is a factor that nobody can influence. So it's important to understand all this in the long run so you can begin to make plans. So remember, a single cycle will range about 950,000 to about 1 million. This cycle will involve inquiry, registration. Your cost of drugs is not included. 2 cycles is about 1.3 million naira. The same inquiry, registration, and cost of drugs excluded. 3 cycles about 1.8 million. Now, I don't want you to just focus on the fact I'm mentioning all this money. I want you to remember that this is doable. Okay? Whatever happens, it's doable. Your first initial assessment will look at making diagnosis. You get all the information you need. Then you think about the consultation fee. During that consultation fee, we also do what we call transvaginal scan. When we are doing transvaginal scan, we're actually looking at the totality of your womb to see where things are situated. That particular initial visit might be about 100,000. Then your diagnostic test should be about 160,000. So the more you have more need, the more you might have a need for more money. So there are some people that will need what we call laser assisting hatching. Some men might need surgical collection of the sperm. That alone is about 250,000. Now, if you need to conduct your pregnancy scan, by the grace of God, by the time you are already pregnant, that's 45,000 naira on its own. Now, in IVF, we normally monitor your follicles. So when we are giving you drugs to stimulate your ovaries, we monitor your follicles. So per monitoring, per scan, it's 45,000. Now, some men might also have a need to go for sperm washing. So for anything you're doing extra, you're going to spend a lot of more money. So people that will go for donor sperm will spend extra 300,000. People that will go for blastocyst transfer will spend extra 100,000. People that have a need to store the egg for later, storing your egg should be about 210,000 at the long run. Now, some people might have a need to go for histology. That means you need to make sure that the tissue is actually in a good place. Some women might also have a need to go for endometrial scratching. Now, some men might also have a need to repeat their seminal fluid analysis. That one is about 30,000. So you can see that overall, the cost of your IVF is dependent on your age, is dependent on the number of cycles, is dependent on the expertise, is dependent on a couple of things you might need further. So some people can go for what we call trial cycle. And when you are going for the transfer proper, we will sedate you. So the cost of anesthetics is about 50,000. So everything about IVF, in a nutshell, it's well planned. So the more well planned you are, the better you will be to have a relatively reliable prediction about the cost of your IVF. So these are very important factors you have to consider. Top on the list, it's your readiness. If you have been told you need IVF, my brother, my sister, if it's medically confirmed you need IVF, the earlier you do it, the better. This is the reason why. If you are above 35 and we have tried other methods of treatment, fertility treatment, IUI, and all of those stuff, and it failed, you've had 4 failed IUIs, it's important you step up your game. The more you delay an IVF you need, the more the likelihood that it will not succeed. So the older you are, the more difficult it gets. Now, if you are already 40 and you have made up your mind to go for IVF, you are better served going with donor eggs. Donor eggs will give you more reliable outcome. Some women will insist on using their own eggs when it's not viable. You don't gain anything using a poor quality egg. When you use poor quality egg, you're going to have poor quality outcome. You cannot spend millions and you don't have good outcome. Remembering that not every woman will succeed in the first cycle. Some women might need 2 cycles, 3 cycles before they will succeed. So the most important thing if you're considering IVF is to do what? To take that bold step immediately. So I encourage you to take the bold step. Considering the age, considering the number of cycles you will need, considering other support system, different things you need to understand, making your research, making sure it's a quality place, looking at the numbers, asking questions, internalizing everything you're learning from this group. If you can do this, by this time next year, by the grace of God, you will be a mother. Now, the beautiful thing about going for IVF, if your womb and other parameters are favorable, you can actually have more than 1 baby. Majority of the multiple pregnancy you're seeing out there, they actually went for IVF. So I encourage you to take your bold steps today. You might not have a baby in 2021, but you can have 4 by this time next year. You can have 3 by this time next year. You can have 2 by this time next year. And you have an advantage as a woman above 35 to have multiple pregnancy, because God designed it in such a way that even when you have fewer eggs, even when the quality of your eggs are reduced, when you eventually become pregnant, you have a higher probability of having multiple pregnancy. So take your choice and your chance today. Okay, so we'll quickly take care of your questions. So let's see what we have. Excuse me. Okay, Concerning the cost, do couples need to pay all the cost at once? No, matter. Now, different fertility clinics, different IVF providers understand that the economy is hard. So they have different payment packages. Some of them will give you a long period to finish the payment. So the provision of paying an installment is there. So when you're going for your first initial consult, you will have an opportunity to interface with them and ask them questions. Now, for our IVF providers in Nigeria, I have a couple of locations where I have very good guys that have produced results in Nigeria. The guy in Lagos is doing amazing. My verified certified provider in Abuja doing amazing. The Abuja guy has delivered quadruplets, like 4 times, triplets. Twin is like pure water. So it's possible. So, but the only thing you need is to make sure that whoever you're using is user-friendly. You see, it's one thing to raise 1 million, 3 million, 5 million to go for something, and they are not even giving you the information you need. And you don't have that opportunity to get feedback. So you don't have that opportunity to get your comprehensive report. I encourage all our members to request for their reports. You see, when you're under me and you're telling me something verbally, if you don't give me a report, I might not agree with you, because how you will understand what the doctor explained to you might not be the way I will understand it. So always request your report. So yes, the cost can be discussed with the providers. And will there be a few initial inquiry? Correct. Most IVF providers will give you a free opportunity to make your inquiry, get all your information, then you go home and decide. So you have a role to play in your own decision. How much does the drug cost? So from my research, about 500,000 or thereabout. So remember that the cost of the drug is just standalone. The reason why the drug is very expensive is because most of them are imported. Now, the quality of the drug is important too. You don't want to go to a place that will be injecting water into your system. So unfortunately, they have to import these drugs. So the reason why the IVF drugs are expensive in Nigeria is because they're imported. And remember, in Nigeria, we have UPNEPA. So storage of those drugs is very important. Now, when you get these drugs, it's important you know how to administer them. You will make the worst mistake in your life if you pay a lot of money, then you go back and you're injecting those drugs into the muscle. You don't inject into the muscle. If you don't understand your acts, what we normally do is to empower the male partner to be the doctor. So we teach your partner how to give you the drugs. Some of the drugs you're going to put on your belly. Some of them is going to be on your buttock. Some of them will be in your thigh. We teach you how to raise the skin and give that drug, importantly, in the dosage you are supposed to give it. Once you make a mistake in administering the drug, you're not going to respond properly. Some women might have their cycles canceled. You don't want to go to Nigeria and spend a lot of money and it fails because of your lack of understanding. So very, very important, okay? Do we have recommendation for IVF providers? Very important question. We actually have only few selected, verified, evidence-based providers of IVF. They have succeeded severally. So we have one in Lagos, amazing guy, good guy, one of the best. We have one in Abuja. We have one in Enugu. We have one in Port Harcourt. So if you're in Lagos, if you're in Abuja, if you're in Enugu, and even in Oka and Nnewi to an extent, but the places I mentioned is the place I have understanding to exchange ideas, to co-manage, and we have a good outcome. So I don't care if you're in Nigeria, if you're in America, if you're in Australia, if you're in Canada, what you can get in America, in Canada, in Australia, you can get in Nigeria. It's happening there. The beautiful thing is when you succeed in becoming pregnant, you can actually come back and start your ASC. So my client that went to Nigeria from Atlanta in 2019, she was coming back to the US. She boarded a plane. She started talking to an African-American lady that probably went somewhere. And they got talking. She was so happy. So the African-American lady was asking her what's going on. She told her, oh, my doctor referred me to Nigeria and I'm pregnant. I succeeded in having IVF in Nigeria. And that's how the African-American lady had to go back. and used the same provider and succeeded in having twins. My client actually succeeded in having a baby girl, but the person she introduced had twins. So you see, sometimes you might be some other person's God. So I want to believe that when you listen to this video, you can actually energize yourself. You can actually encourage yourself to go and try again. It's not over. Unfortunately, there are women that the only way they can give birth is IVF, surrogacy, adoption. They are all okay. And it's unfortunately expensive, but you have to do what you have to do, okay? Does success rate of IVF center affect the cost? Actually, yes. So you want to go to a center that has had 5,000 success rate. Even when the differential is about 100,000, even if it's 200,000, you can afford to pay extra 100,000, extra 200,000, but you have a good outcome. So when you are shopping for the place, you will go for your IVF. While you're looking at the cost, review that center, investigate, ask directly. Now, no center can have 100%. Anybody that tells you they had 100% IVF, that person is a scammer, is a crook. You report the person to WHO. There is nobody that can have it all the time perfect. It fails. It can fail. The best IVF provider can do everything possible and it will fail. The person that might be starting can succeed. But the more you do things, the more you have experience, the more you have good outcome. So the cost and the quality, you must marry them together. So while you're looking at the cost, virtually all the IVF centers in Nigeria should have about the same cost. The difference might be 100,000, 50,000 here and there. So whatever happens, make your inquiries. Make sure you follow due diligence. And please take your bold step. So if you need to go to Nigeria, if you're not a member of our group, Snowspirations, this is my YouTube channel. We show up every day. Now, if you are in Facebook, we have two groups in Facebook. You can be in Snowspirations Health Hub. It's a health hub. It's a community of about 21,000 people that come together. They love each other. They listen up. We show up every day. Now, we also have a page. Our page is a community of about 80,000 people. Then my personal page, I have about 85,000 people. So cumulatively, there are so many thousands who are changing their lives just by exposing them to the knowledge they need. So if they have told you in the past that you need IVF, my sister, my brother, this is not the time to be arguing. This is not the time to be leaning on your own understanding. Your own understanding might actually not be God's understanding. And God's understanding is the best understanding. So I'm encouraging you, explore all available opportunities. Ask your organization, ask your boss, ask your pastor, ask your family people. You just have to do this. Money, I know, is involved. But guess what? Your babies are more expensive than anything in this world. So tomorrow is September. People in Australia, they've already entered September. Definitely people in Nigeria, I think you guys have entered September already. I'm still in August. So that's why I'm still preaching about August. When you wake up tomorrow, 1st of August, 2021, ask yourself a simple question. What have I achieved in my infertility journey in 2021? Have I succeeded in becoming pregnant? Am I currently pregnant? Have they found what the diagnosis is? What is my game plan to become a mother, to become a father in 2022? If you can't get a concrete answer, then you better do something, my people. If you notice, I'm sporting my motto. I believe in praying to God every single day. Then I also believe in doing the work. In infertility field, doing your work means making love with your partner 48 hourly. So remember, when you are shopping for your IVF money, when you are shopping for this and that, don't stop your love making. It works. You can suddenly become pregnant when they told you you need IVF. Some of you might go to a wrong place to do your HSG, and they might give you the worst case scenario that your tutus are blocked. But you might actually have a mild block too. And when you went for your HSG, that fluid actually dislodged the mild blockage, and you became pregnant. So regardless of your diagnosis, keep on praying, keep on making love, 48 hourly, then practice. Practice means if they told you need IVF and you need to go to Nigeria, you start going immediately. You don't dilly-dally. Okay, so thank you so much. So follow Ebenezer. Make sure you follow our group. The name of my group is Snowspirations Global Health Solutions Health Hub. Our page is Dr. Trudy Ufondu Snowspirations page. So they are very simple. If you are watching me for the first time in YouTube, I show up every day by 7 p.m. Make sure you subscribe. When you subscribe, make sure you click on the notification, then share. Just sharing can help somebody today. You can actually be someone's angel today by just sharing the good news. So thank you for coming. Tomorrow, we're going to look at why IVF fails. What's next? So what are those reasons that can lead to failure of IVF? That's what we're going to look at tomorrow by 7 p.m. So it looks like the whole of this week, we are going to look at IVF. Thank you for coming. I love you. I appreciate you. And I'll see you tomorrow. Ebenezer, thank you so much. Bye-bye for now. Dumeja?